Is healthcare a universal right or a luxury only a few can afford? This question is not just a philosophical debate, but a real-life paradox millions grapple with every day. Healthcare, in its essence, should be a universal right. It's the cornerstone of a thriving society, the bedrock upon which we build our lives. It's about more than just treating illnesses or managing conditions. It's about fostering wellness, preventing disease, and promoting overall well-being. It's about children receiving vaccinations that set them up for a healthy life. It's about adults getting timely screenings that could potentially save their lives. And it's about seniors accessing the care they need to live their golden years with dignity. Yet, for many, healthcare seems less like a right and more like a luxury. It's a paradox that in the 21st century, in a world of unprecedented medical advancements, healthcare accessibility remains a challenge. Instead of being a shared resource, it often feels like a prize only some can claim. We're not just talking about remote corners of the world here. This is a universal issue, affecting people in both developing and developed nations. Many face a labyrinth of obstacles in their quest for healthcare. Geographic distances, financial constraints, lack of insurance, or even a shortage of healthcare providers. These hurdles can make the journey to health feel like an uphill battle. And then there's the cost. In many cases, the price tag attached to healthcare services is staggering. For some, a single health emergency could mean financial ruin. For others, the high cost of medications makes it impossible to manage chronic conditions. People are forced to make impossible choices every day, between health and debt, between medicine and meals. So, we find ourselves in a world where healthcare is both a necessity and a luxury, a universal right that's not universally accessible. It's a paradox that calls for our attention, for our understanding, and most importantly, for our action. Let's delve into some real-life case studies that illuminate the stark realities of healthcare accessibility. Imagine living in a remote area, miles away from the nearest medical facility. Let's dive into the story of Jane, a 50-year-old woman residing in a rural community in the heart of the American Midwest. Jane suffers from a chronic heart condition that requires regular medical attention. But the nearest hospital is over 50 miles away, and the local clinic is often short-staffed and under-resourced. Jane's reality is far from unique. It's a shared struggle for millions of individuals living in remote and rural areas across the world. The distance to the nearest healthcare facility can often be a journey of several hours, sometimes even requiring overnight stays. This isn't just a matter of inconvenience. It's a life-threatening barrier that can delay critical interventions and regular checkups, leading to worse health outcomes. Then there's the issue of transportation. Public transport is scarce in many rural areas, and private vehicles may not be affordable for everyone. For someone like Jane, who lives on a fixed income, the cost of fuel for a 100-mile round trip can be prohibitive, not to mention the wear and tear on her vehicle, or the days she's too unwell to drive. Lastly, rural areas often suffer from a scarcity of healthcare professionals. It's not uncommon for a single doctor or nurse to serve an entire community. This leads to overworked healthcare workers, long waiting times, and ultimately, a lower quality of care. These challenges, distance, transportation, and limited healthcare resources, form a formidable barrier between rural communities and the healthcare they need. They contribute to health disparities that can span generations and are a stark reminder of the inequalities that exist within our healthcare systems. This is just one example of how geography can severely limit healthcare accessibility. It's a sobering thought, but it's also a call to action. We need to recognize these barriers, understand them, and work diligently to dismantle them, ensuring that everyone, no matter where they live, has access to the healthcare they need. Now consider a middle-class family living paycheck to paycheck, and a sudden health emergency strikes. Imagine this: a family of 4, working hard to make ends meet in a middle-income neighborhood, suddenly faces a health crisis. The father, the primary breadwinner, suffers a heart attack. The family is plunged into a whirlpool of hospital visits, medical procedures, and mounting bills. This is not an uncommon scenario. It's a snapshot of the financial barriers many households face when dealing with healthcare. The high cost of treatment is often the first and most formidable barrier. Even with advances in medical technology, life-saving treatments can come with a hefty price tag. From doctors' consultations to medications, from diagnostics to hospital stays, every step of the medical journey can drain a family's finances. Then, there's the matter of insurance. Not every family has access to comprehensive health insurance. Even if they do, policies might not cover all aspects of care. families may find themselves paying out of pocket for treatments and procedures that their insurance doesn't cover. This can lead to substantial debt, creating a financial strain that extends beyond the immediate health crisis. This strain isn't just about money, it's about the emotional toll, the stress of not knowing how to navigate through a sea of medical bills while trying to focus on a loved one's recovery. It's about the sacrifices families have to make, perhaps cutting back on necessities or dipping into savings meant for their children's education. Even when the acute phase of the health crisis is over, the financial aftershocks can linger. There may be ongoing costs for medications or rehabilitation. There might be lost wages if the illness leads to prolonged absence from work. All these factors can push a family's finances to the brink, making the road to recovery a daunting uphill climb. In essence, these financial barriers can make healthcare seem like a luxury rather than a fundamental right. They can force families to make tough decisions, choosing between health and financial stability. For many, the cost of healthcare can be a significant barrier to accessing necessary services. What happens when you're uninsured or underinsured in a health crisis? Imagine a woman. Let's call her Jane. Jane works at a small business that doesn't offer health insurance. She falls into that precarious category of individuals who earn too much to qualify for Medicaid, but not enough to afford private insurance. She is, in essence, uninsured. One day, Jane wakes up to a sharp, persistent pain in her abdomen. She tries to ignore it, but the pain persists. She finally decides to visit the emergency room, the only place she knows that won't turn her away for lack of insurance. Jane's situation is not unique. Across the United States, millions of individuals face the same predicament. They are uninsured or underinsured, living one health crisis away from financial ruin. For these individuals, accessing affordable healthcare services can feel like navigating a treacherous labyrinth. The challenges are manifold. For starters, the uninsured and the underinsured often face high out-of-pocket costs. Without the bargaining power of insurance companies, they may be charged exorbitant fees for medical services. For Jane, a single visit to the emergency room can cost hundreds, if not thousands of dollars. There's also the issue of preventive care. Without regular checkups and screenings, conditions that could have been detected and treated early often go unnoticed until they become serious health crises. Jane's abdominal pain, for example, could be a symptom of a more severe condition that has been left untreated for too long. The risk of medical debt is another significant challenge. Medical debt is one of the leading causes of personal bankruptcy in the United States. For someone like Jane, an unexpected health crisis can quickly spiral into a financial catastrophe. In the face of these challenges, the uninsured and the underinsured often delay or avoid seeking medical care, further exacerbating their health issues and potentially leading to more severe and costly health problems down the line. Insurance coverage, or lack thereof, plays a critical role in healthcare accessibility. And for the millions of Janes out there, resolving this issue is not just a matter of policy, but a matter of life and death. So, how do we make healthcare more accessible and affordable for everyone? To answer this, let's first summarize the challenges we've discussed. We've seen the paradox of healthcare accessibility, where the most advanced treatments may be out of reach for those who need them the most. We've delved into the issues faced by rural communities, where geographical distance can pose a significant barrier to care. We've talked about the financial hurdles that many face, where high costs can deter individuals from seeking necessary medical attention. Finally, we've discussed the plight of the uninsured and underinsured, left vulnerable by a lack of comprehensive coverage. Now let's talk about potential solutions. To begin with, policy changes are needed at both the national and local levels. By prioritizing healthcare as a basic human right, governments can take steps to ensure that everyone, regardless of their location or income, has access to the care they need. Increased funding for rural healthcare is another crucial step. By investing in rural hospitals and clinics, we can bring advanced medical care to remote communities, reducing the need for long, costly journeys to urban centers. Telemedicine, too, can play a key role here, allowing patients to consult with specialists from the comfort of their homes. The expansion of insurance coverage is another key solution. By making insurance more affordable and comprehensive, we can ensure that no one is left without the financial protection they need when illness strikes. This could involve expanding public insurance programs, regulating private insurance companies to keep premiums down, or implementing a combination of both. Finally, we need to foster a culture that values prevention over treatment. By focusing on preventive care and early detection, we can reduce the burden of disease and lower healthcare costs in the long run. While the path to universal healthcare accessibility may be complex, it is a journey we must undertake because everyone deserves the right to health.